Hello everyone, welcome to my YouTube videos. Welcome wherever you may be viewing me from. My name is Ajibola Morolanke. I'm a registered nurse midwife. Today I'll be talking about a global health challenge, which is hepatitis. According to WHO statistics in 2019, shows that 286 million people are living with hepatitis B. 58 million people are living with hepatitis C. And we will all agree with me that this is a global issue which we all have to work hand in hand to stop the spread of the infection in our society. But before I continue with my video, don't forget to subscribe and like my video. To continue with the video, what is hepatitis? Hepatitis is an inflammatory condition of the liver which is caused by number 1, a pathogen, a viral infection. Number 2, alcoholic consumption. In an heavy drinker, it can lead to inflammation of the liver. Number 3, medication, drug. So medication have the metabolizing and elimination sites in the liver. In an unprescribed drug, it can lead to inflammation condition of the liver. In a prescribed drug, the doctor actually know the mode of elimination and metabolizing of drugs. So they carry a test that they are prescribing a drug to check the effect of the drug on the fighter's organs. But in an unprescribed drug, it can actually lead to inflammation of the liver. And in a drug user, addiction is likely to occur, which can result into inflammation of the liver. Another cause of hepatitis is poor sanitation and environmental condition. And hepatitis has a family label of A, B, C, D, and E. I will talk about each type, causes for each possible outcome, and the prevention of each type. To begin with hepatitis A. Hepatitis A is caused by fecal oral, by contaminated food and water. When an infected person pass an excreta pool in the environment, it can get in contact with a new person to make a new person be infected in a poor hygienic condition. What are now the signs and symptoms of hepatitis A? Loss of appetite, weaknesses, yellowish of the eyes and skin, dark urine, clear stool, abdominal pain because of the accumulation of fluid, breathlessness in a more severe case. What is now the possible outcome? If treated on time and diagnosed on time, it's a short-term infection. If treated on time, it's not going to go into a chronic infection. Moving on to hepatitis B now. Hepatitis B is caused by parenteral, needle stick, needle prick, contaminated blood and body fluid through sexual activities. It can be oral, vaginal, or anal sexual activities. And it's a major cause of health hazard to health personnel. And it's also common infection that is being transmitted from the mother to their two babies. It can be transmitted during pregnancy, labor, and during nursing, that is after the delivery of the baby. What are now the signs and symptoms of hepatitis B? The signs and symptoms of hepatitis B are loss of appetite, weaknesses, yellowish of the skin and the eye, dark urine, clear stool, joint pain, rashes, breathlessness, abdominal pain as well. What is now the possible outcome of hepatitis B? If undiagnosed, untreated, it can progress to a life-threatening condition such as liver cirrhosis, hepatic cancer. Moving on to hepatitis C now. Hepatitis C is also caused by parenteral, needle prick, needle stick, contaminated blood and body fluid through sexual activities as well. The signs and symptoms are as that of hepatitis B. Continue with hepatitis D now. Hepatitis D is also a blood-borne infection through needle pricks, stick, contaminated blood, intercourse with an infected person as well, maybe through vaginally, orally, or through anal, the infection can be transferred. It can also lead to a more threatening condition such as hepatic cancer and liver cirrhosis as well. Moving to hepatitis E. Hepatitis E is also caused by fecal oral through poor hygiene and environmental condition, but it is more severe in a pregnant woman, elderly people, and people with weak immunity. If treated on time, also, it's not likely for it to go to a life-threatening condition. Is how to prevent each type. Now, how we prevent hepatitis A is by maintaining hygienic environment and sanitation and washing of our hand. We should make it an habit to wash our hand thoroughly every time before putting anything in our mouth. And we should consider to take a potable water as well. Avoid contaminated water or food. And there is available vaccine against hepatitis A. Hepatitis A vaccine is available. So, an individual who is likely to travel to an area that is predominantly known for hepatitis A can actually has the vaccine. What is now the prevention of hepatitis B? The first thing is that an individual must know the status. How can individual know their status? Status is for individual to go for tests, screening to know your status. That is the first step. After doing the screening, you have to let a knowledgeable person or a physician to actually interpret your test for you, because you have to have more than one test to do. After knowing our status and the interpretation of the test has been done, the individual will know whether to go for the vaccine or not. And there is available vaccine against hepatitis B. In a person whose partner is hepatitis positive, the partner can go for a test. A physician or a knowledgeable person, health personnel, nurses can actually interpret the result of the test. If the individual is fit according to the review of the health personnel, the individual can now go for hepatitis B vaccine to prevent against hepatitis B. Another way to now prevent transmission of hepatitis B from mother to their children is that, number one, as I earlier mentioned that individual should know the status. The mother should know the status before going to motherhood, because with this, the individual if the need be, the individual may have been taking an antiviral medication which will reduce the viral load of that individual before pregnancy. In this case, the infected person or the carrier will not spread the infection to another person or person is to their children. Harm is more important in an infected mother with hepatitis B or a carrier. After the delivery of their baby, the baby should be given immunoglobulin against hepatitis B within 12 hours of birth. That is a passive vaccination, and the baby will also have an active immunization as well. To have vaccine against hepatitis B as well. And any that those are the way to actually prevent hepatitis B infection. Moving on to prevention of C is also to know our status. The only thing is that there is no available vaccine against hepatitis C. But first thing is to know our status in order to not spread it to another person or go and seek health care. Moving on to hepatitis D now is to also know as individual status as well, and to seek health advice if there need be. In prevention of hepatitis A is as that of hepatitis. In prevention of hepatitis E is as that of hepatitis A, but there is no available vaccine for hepatitis E presently. These are the way we can prevent ourselves and to stop the spread of hepatitis infection. So let's stop the spread. Thank you for staying with me to the end of this video. Don't forget to subscribe and like my video. Make your comments, which I tend to. Thank you. Bye.